Good afternoon, guys. My name is Frank Aguilar, and I'm the head athletic trainer here at Dominguez Hills. I want to welcome all you athletes into this presentation where we'll be talking about ACL injuries. So, first thing is, what is the ACL and who is susceptible to this injury? So, the ACL stands for anterior cruciate ligament. It is one of the main stabilizers of the knee, and this ligament prevents excess forward movement of the tibia and the femur. So, for example, I'm pretty sure a lot of you guys are familiar with uh, hyperextended knees. The knee hyperextends to a severe case, then that's when the ACL tears. The ACL tear is mostly heard of in sports, and athletes from all sports are prone to it, males and females. And there are many factors that contribute to this injury. The etiology. This injury could be a direct blow to the knee, or it can also be a non-contact mechanism. It can occur from a sudden twisting movement after a sudden change of direction or while pivoting or landing after a jump, according to hss.edu. And a fact about the ACL injury: the women are 6 times more likely to have this injury in sports. So, what are the signs and symptoms of this injury? So, according to Kurt P. Spindler and Rick W. Wright, the number one sign of an ACL tear is a pop and the knee giving out. So, a lot of times, once they plant and they hear that pop, it's an indicator that it might have been the ACL. Sometimes it could be a direct blow, but with a direct blow, it's hard to hear the pop. So, in that case, the pop isn't really heard. Some symptoms include severe pain, disability, a lot of swelling, and laxity. Laxity, it can be determined to the Lachman test, and this is basically when us as athletic trainers we push the femur and the tibia up and down to see if it's loose. Um, most ACL tears are full ruptures of the ligament, and then surgery is required. For those of you that have suffered an ACL tear, you guys know that going through surgery and the rehab process it sucks. So what do you do if you sustain this injury? After having this injury, you must reduce the swelling with ice immediately, and then if you cannot walk, use crutches. Um, Sometimes you can also wrap the knee just to prevent the swelling or just to lower the swelling. And then after this, once you go home, an MRI you need an MRI to diagnose the grade of the injury and how severe it is. There's three grades to these ligament injuries. The first one being a partial no tear at all, just like a bruising of the ligament. The second one is a partial rupture, and then the third one is, which one is the most common, is a complete tear that requires surgical repair. So recovery for the ACL surgery varies from 6 to 9 months, but it can last up to a year depending on how the athlete uh, evolutionizes the recovery, according to Cleveland Clinic. Um, Bracing techniques and taping for this injury. Um, I wouldn't say they help a lot, but they do help with stability. But they can prevent an injury to the ACL because it's a deep ligament inside of the knee. Um, After surgery, the knee brace is worn for quite a while, and the doctors are the ones who clear the athletes to come back to training and physical activity once their rehab process is complete. The brace and taping are recommended for support, but after rehab, they're not needed. Here we can see how the taping provides support on both the medial side and the lateral side of the knee, while also going under where the patella is and where the quad muscles are. So one thing that can help with preventing a ACL injury is stabilizing the muscles. For example, the quads, the quadriceps, the hamstrings, the calves. Um, and yeah, that's pretty much it. I hope you guys learned a little bit more. So here's another slide. They're hard to prevent most because most are non-contact related, and like I said, they could be stabilized with straining the muscles around the quads, hamstrings, calf, and also using balance exercises to help prevent this injury. So yeah, guys, I hope you guys learned a little bit more about the ACL injury, and thank you guys for your time.